Hello, I am here to do my blood glucose administration or blood glucose check and insulin administration video. I will begin by knocking before entering the patient's room. I enter the patient's room after doing hand hygiene. Do hand hygiene on the way in. I talk to my patient, introducing myself to my patient. In this case, my patient's name is Melanie Barnes, born on 7/1977, but I'm going to ask her. Hello, what's your name and your date of birth? Okay, Melanie, that's what I have here. Yep, you were born 7/19/1977. Okay. So after introducing myself to my patient, I'm going to explain what we're going to do. Okay, so what I'd like to do is get a blood glucose level from you. That'll tell me how much sugar you have in your blood. And after I do that, I'll go prepare and bring back your insulin so that you can take your insulin before you eat. Do you have a meal ordered and prepared? Good, okay. So your meal is ordered. It will be on its way soon. Okay, well that's a good thing. We want to make sure that we're not giving you insulin and dropping your sugar too low. Let me go ahead and get some gloves on, and then I'll begin giving you a blood glucose check. Okay, I have my supplies over here gathered, so as I put on my gloves, I open my glucometer. Oh, okay, you're using different lens sets. Oh, there's the lens, that's good. I didn't want to have to use that other one. Okay. So glucometer, my alcohol swab. I'll take that straight over there. I think that's a lot easier. Okay. I'm going to inspect the patient's fingers. Do you have a finger, a site that you prefer to have your sugar checked on? Okay. If I saw any infections or anything, a finger that's chewed up, any bleeding, anything where it seemed like it would be inadvisable to use that site, I wouldn't use it. Otherwise, I would go by a patient's preference, and if they didn't have a preference, I'd choose a site, reasonable site for them on the finger here. Go ahead and wipe the finger and wait for the alcohol swab to dry, or the alcohol to dry. Using the ring finger, because I guess that's the site we're using today. As I wait for that to dry, I'll go ahead and get the test strip ready. Put that in the glucometer. Okay. There we go. I calibrated this at the beginning of the day. Okay, let's try the strip again. Okay. So now we get the lens set. I removed the protective cover, and now I have to trigger the lancet. I did it on the ring finger is the one that I had wiped clean, so I'll go on the side of the finger here and depress the lancet into the finger. Okay. I will go ahead and grab a cotton swab or gauze, in this case cotton swab, and wipe the initial blood off. I will get the glucometer. Falling asleep, so I had to put that strip back on it. Let it suck it up by capillary action. Get a reading. If the reading was low, then I'd take corrective measures. Maybe give some orange juice if the patient was hypoglycemic. If the patient wasn't hypoglycemic, then I'd continue as normal. But if the patient was hypoglycemic, I would not give insulin. I will put this in the sharps container, the lancet goes in the sharps container. And otherwise I will clean up and throw away all the other components here. Put my glucometer back into my bag. In this case, I didn't raise the patient up for this procedure. I could have done that. If I had done that, I felt, I probably should have, but I didn't do it. At this point, I'd lower the patient, make sure they're within the call light, let them know the procedure's done. Okay, we finished that procedure. If there was still some bleeding, I'd give them a Band-Aid, or let them hold the cotton swab give them that cotton swab, let them hold it on there until the bleeding stops sufficient a lot of the time. Otherwise, I'd give them a Band-Aid, give them a choice between Hello Kitty or Ninja Turtle Band-Aids, and make sure they didn't need anything else before I left the room to get the medications that I'm going to administer. Okay, and then I do hand hygiene on the way out.